Hello, everyone. We're starting a new webinar. It's called Younger Lifestyles. We're going to look at ways to make a better brain as you grow older. So it's the way to be. First, we start with good nutrition and minimal exercise. And minimal exercise can be simply stretching. Stretching is by far the better thing for older folks than heavy duty exercise. So you want to get away from heavy duty exercise. You want to do minimal exercise and or stretching. And you'll keep healthy and you keep your brain healthy. Now there's two key points. You have mind power, and you should know that your mind and conscious has control over your body. So your brain and your subconscious world will be directed by your brain and your conscious world. And you do this with repeated self-affirmation. Say you will do something. I will become younger. I will do this. I will jump higher. I will so on. It's proven. It's very similar to self-hypnosis, but you're in control. You don't have to worry about some other person helping you. You can do it yourself. The second thing, we have new science going on for the last 15 years, and it's called low-level intranasal laser light. It's a way of healing the front part of the brain to calm down Alzheimer's, Parkinson's, and dementia. It really works. The man leading this, his name is Dr. Joe DeNiro. He is definitely a compatriot of mine. He runs a nonprofit clinic in Costa Rica, and he's written this book, My Brain Matters. Two chapters out of the book are pretty techy, but most of it are pretty easy reading, and there's over 500 references. This man has a master's in research science. We have something in common. He has a nonprofit clinic. He's a researcher. I have a nonprofit clinic. I'm a researcher. He's a chiropractor. I'm a doctor. All right. Now, the three axioms of getting there are good diet, good rest, good exercise. So first, as you get older, you have to understand your metabolism generally is not as fast as it used to be. Especially as a young kid, your metabolism is super fast. So with super fast metabolism, you can eat a lot of things and get away with a lot. As you get older, the nightshade family of vegetables are not good for you. And we're talking about white potatoes, eggplants, bell peppers, tomatoes, not so good. And it will worsen arthritis symptoms. That's proven. The good vegetables, carrots, broccoli, spinach, and so on, and the red bell pepper. The red bell pepper is nothing more than the ripened green bell pepper. But the difference is incredible. It's more vitamin C, 8 times the vitamin A, and it has all these supplement chemicals in it that we found out help different parts of the body. In general, better exercise, better sleep, better nutrition. So stretching and aerobics for your exercise. If you sleep on your back at a 20-degree angle, you will stop snoring because you're no longer in a position flat, which is actually backwards. It's actually downhill as far as the body's concerned, and that causes you to snore. It's like in the hospital, when you come up from the bed, that's the best way to sleep. Better nutrition. As you get older, you must take multiple vitamins because there are trace elements that you need to get that's really difficult to get any other way. Take B complex for energy. Your B's and C's are water soluble, so you can take as much as you want. Your body will take what it needs. There's a new drink out. It's called Kick-Ass. There's a series of Kick-Ass drinks because they are super healthy, and they do kick ass. And number 4 is a new product, coconut water with 4 MCTs. And these are added MCTs at low dosage. MCT stands for medium chain triglycerides. These are essential proteins that the brain needs, but the body doesn't make it. So you got to pipe them in somehow through your diet. Well, here's a very easy way to do it, and it's such low dosage that you can drink more coconut water if you wish without overdosing. To get better sleep, minimize your water intake before you go to bed and any food. If you had to do something, small snack, small water. Um, and if you sleep on your back at a 15-20 degree angle, you will stop snoring. If you are not comfortable with that, you want to sleep on the side, sleep on your left side, because your right side is where the blood flows. Okay, you don't want to cut that off. You wake up numb, that's why. Don't sleep on your right side, and absolutely do not sleep on your stomach. That was good when you were like 2, 3 years old. That's changed. When you have to go urinate when you're older, you have to be careful. Get up out of bed, sit in the bed until you are stabilized. Then get up and make sure you have light and you have things to hang on to as you go to the bathroom. We all know as you get older, if you fall, that's the bad news. Okay? So you don't even want to go there. Just avoid it to begin with. Your supplements, multiple vitamins, B complex daily. Curcumin, quercetin, and bioprene. Bioprene is just an activator, but all of that combination will increase stamina. All right, and in the end, you have to use the brain. And you can use it playing memory games. You can use it playing chess. You can use it playing bingo. The trick is to use the brain. Don't just forget it. Use it. Learn speed reading skills. Those people that know speed reading actually read in a more of a visual mode than talking to themselves mode. That's much faster. And if you can run much faster, you make the brain work much better. I was fortunate in early college life. I taught speed reading, and that was an amazing experience. That's part of the reason I'm a doctor today. You need to learn a new language. That would be a good thing. It's always cultural. You go the world and you know the language wherever you travel. That's pretty cool. Learn to play a musical instrument, of course. So, and you'll end up like this lady here, rejoicing in the sunset or the sunrise. Okay, so we have covered younger lifestyles, the basics, diet, sleep, exercise, and learning the right kinds of medications and new technologies heading our way, like the intranasal stimulation of the front part of the brain. So we make a better brain. Questions?